Welcome to Straight Talk About Health and Wellness. My name is Mary Henderson and I am your host. Straight Talk About Health and Wellness, we have straight talk with straight conversation and real stories. All right, today we are going to be, our topic will be breaking the silence. All right, according to the National Institution of Mental Health, there is 60 million adults that suffer from mental health. All right, so we're going to be talking about the ins and out of that, and we have an expert person to give us that information. Okay, one thing about Straight Talk About Health and Wellness, I always tell you grab a pencil, grab a pad, grab your favorite coffee, grab your favorite tea, because you will have information you may want to share with your neighbors, your co-worker, or just for you to live your better life. All right. Just remember that Straight Talk About Health and Wellness, we do not diagnose, we do not treat. All right. If you do have some concerns, please contact your PCP first, primary care physician, and have that conversation. All right. So we're going to jump right in it. Thank you for coming and thank you for everything, all our episodes. All right. I'm just lost for words. All right. Today we have Dr. Aminita Sutton. All right, she is the chair of Health and Human Services at the Contra Costa Community College, where I started, you guys, and it's still there. That was a joke. But anyway, she is an author, she is a speaker, she is a transformational life coach. All right, and she's also a mental health first aid instructor. And I think she is a pastor's wife also.
That is
so correct. All that in one. So we are in for a treat. Good evening, Dr. Sutton. How are you?
Good evening to you, my beautiful sister friend, Mary. Good afternoon to you. Excited to be here.
Oh, I am too. I'm so excited you're here. Thank you. I want to thank you. Thank you for taking the time to be with me today. Yes. It is an honor and a privilege because I know you're so busy. All right. Our topic today is breaking the silence.
Yes.
Breaking the silence that's in our community. So I'm going to start off by asking you, Dr. Sutton, how do you define mental wellness?
That's a good question to start because usually when you mention mental health, mental wellness, mental illness, people get kind of strange. But I define mental wellness is the absence of breakdown. I'm just going to put it in simple terms. It's like feeling like your full self on a Monday morning, even before you have a cup of coffee. As I have shared that sometimes individuals say they cannot function without a cup of coffee, but mental wellness is being able to function without that cup of coffee and having the tools to live your life in everyday life. It's not just surviving life. Mm-hmm. It's about living and thriving in life. Mm-hmm. And so when I say that I am mentally well, it means that I have done my own health check.
How are you health check?
How are you doing today? Uh-huh. And I really appreciate that because often in society, we talk about mental illness. But what if we talked about mental wellness? That would be so much better to really think about our mental wellness every day. It's not a day that we should take a break about our mental wellness.
So you need to check in. So you're saying we need to check in every day with ourselves.
Yes, with ourselves first. Because how can you help somebody else if you're not spiritually, physically, financially, emotionally ready to work with others and you haven't done your own self-check? So I think it's really important to do your own self-check first before you start working with other individuals.
I believe that so many people, they do not know the difference between mental wellness and mental illness. Can you
Yeah.
explain that to me? The difference?
Yes. I like to start with mental wellness because mental wellness means that you are doing what we said. We're doing that self check.
Mhm.
Everybody should do a wellness check. It's not to send the professionals out to do a mental status check, but check yourself first. I appreciate that because every day in the field, we have to do our own because there's so many things that are happening in life. We have
Mhm.
to check ourselves first. And mental illness, a lot of times people focus on the illness, the diagnosis,
Mhm. The
the
diagnosis.
yes, the
Yeah.
diagnosis that they may
Mhm.
have been given by a medical doctor or a psychiatrist, psychologist, or someone
Mhm.
working in behavioral health. So
Mhm.
a lot of times the mental illness is focused on what's wrong, but the wellness is focused on what's right or what could be right. So I like to separate the two whenever I'm speaking about health. It is about the wellness of an individual and not the illness. Although that is important, but we
Mhm.
think about the wellness for every aspect.
I see. So mental wellness is actually the maintenance care.
Yes,
I'm
yes,
thinking. Yeah, that'll be sort of like maintenance, checking in, making sure you
yes,
check everything. That's almost like when nurses do assessments, and
yes,
we have to come every 6 months. Your
yes,
blood pressure, your weight. Well, I don't know
yes.
about the weight. That might not be a good idea, but it needs to be checked.
But it's
It's
so
things like
important
that.
to keep those
It
things
is.
in mind, right? You
It
know, if you
is.
find out something is wrong
Mm-hmm.
and you're saying like you go back to the doctor or whatever to get that
Uh-huh.
self check, then we want to see some improvement. We want to see
Exactly.
some improvement in what the diagnosis is or how you're coping with life.
It's coping. Can
Yes.
you can you explain to us the common mental health challenges that we face today? We have a new administration. Life has changed.
Life has changed.
So, what are some of the challenges that we have today?
Mm, I think, and I'm very clear what I see at work, what I see in the church, what I see in the community. People are anxious and people are burnt out. Those are the two diagnoses and depression, right? Those are on the rise. Anyone you speak with, a lot of times they'll say, "Oh, I'm stressed out. Oh,
Mm-hmm.
I'm anxious about what's going to happen. Will I have care? Will I have what I need in life?" And,
Medical insurance.
it's like
Mhm.
stress got a promotion. I know that that sounds kind of funny, but it got a promotion
Oh,
because
I agree.
we've gone to I'm fine to I'm tired.
Mm-hmm.
And when we think about it, if you're constantly tired,
Mm-hmm.
then we're out of alignment. So I think the shift has really gone that way where we can say, I'm instead of I'm fine, is
Mm-hmm.
I'm tired, or I'm anxious, or I'm depressed.
Mm-hmm.
And being able to voice that, that's a common thing that we used to not be able to talk about. We only wanted to talk about what is wrong. But now we're able to shift the atmosphere and say, hey, I am feeling overwhelmed and tired and
Mm-hmm.
burnt out from
Mm-hmm.
my job or whatever.
Mm-hmm.
Hmm.
So you're able to, when they're able to express. That was my next question.
Yes.
All right. My next question was, if you run into someone or one of your patients seems to be unmotivated, tired,
Yes.
overwhelmed.
Mhm.
All right. So, what would be some of the tools that you would suggest that they do?
Well, I believe that you and I are in sync. You do nursing and I do healthcare, mental health care. And I believe that if we start with our own selves, that we can work through those things that try to hinder us. So, for instance, what do we do? Instead of picturing like in the old days of lying on a couch, we don't do that much anymore. We may be in a coffee shop, we may be in a quiet room, we may be somewhere else. But somebody who doesn't feel like they're connected, we should also know that as trained listeners, we have to be able to listen with the third ear. And in my practice, I use listen with the third ear, which is the heart, because in heart you have ear. So can you listen attentively to the individual? So when people are stressed out, listen. Be able to listen and let them listen to themselves as well. Because when you're talking about what you're experiencing, a lot of times in counseling, coaching, therapy, you can listen to yourself and say, oh, I see why I'm responding the same way because I haven't changed anything that I was doing in the past. So if we realize that, then we're thinking about our self-care and able to connect with how we're feeling with the third ear, that heart, and listening and responding in a way that we are very clear, like, oh, yes, I need to change some things. So when people feel unmotivated, start with self, check self first, and then be able to dig deep into the heart, to the mind, and to the body about what's going on.
Nice, nice. I'm getting ready to change gears now.
Yes, please do.
Do you think social media have an effect on how we feel?
Yes, our social media, we're bombarded by it, right? We're bombarded. Even if you don't want to watch TV or YouTube or TikTok, how many things are there? I think there's like 15 different platforms that you can go on. Social media is 24/7. And you can get caught up with trying to be somebody else, trying to act like somebody else, trying to dress like somebody else. But our social media is like reels of life. You know, they say they have you. Are you doing a reel? Yeah, doing a real life. And but there's no bloopers. We can't take out the bloopers of life. But in social media, we get that quick flash and we say, oh, that's how I should be responding. But we don't get the full picture. So in social media, as we're learning more and more about, how to navigate the world, I tell people, take the opportunity to stay off of social media for a minute. See how you're thinking, see how you're responding, see how you are reacting to something that the social media hasn't already impacted you on. Because in social media, we have all those things that influence us in a way that says, that's how I think about it too. But we have to really put our own thought processes in that event or that situation or circumstance. So social media is good, but
in one way.
In one way. Yes. But what about the other ways? What about the other ways?
I know. Well, Dr. Sutton, we have had this stigma in the African American community about mental health.
Yes.
Okay, we are here in 2025. I remember when I was a young girl. A couple years ago.
Yeah, that was just a couple years ago, girl. I'm right with it. You have gray hair. I do.
Oh, but you look gorgeous with your gray hair. Gorgeous. I remember my dad would tell my brother, "Don't cry. You're a man."
Yes.
I remember. Yes. Do you think And that was in 19, I don't remember.
Yes,
But
yes, back in
anyway,
the day.
you're in the day. But now with 2025, do you think that that has improved in our community?
You see, I have to do a sigh on that one. Because uh, we are getting a little better,
Hmm.
but sometimes people are stuck back in the day and they say, we don't talk
Hmm.
about our business because it's our
Hmm.
business. But do we really have business when we're trying to hide things? In
Hmm.
the recovery world, we say you're only as sick as your secrets. So you're trying to keep everything private, but
Hmm.
are you getting help? So the stigma behind our relationship with therapy, counseling, coaching, it is very difficult sometimes because even I believe that churches should have places where people can go as well. Yes, we believe
Right.
in the power of prayer.
Hmm.
I definitely believe in the power of prayer, but sometimes
Hmm.
individuals might need medication.
Help.
They may
Hmm.
need more help than um, just praying about it. And
Hmm.
don't get me wrong, I definitely believe in the power of prayer. So, but
Hmm.
I don't want that to just be the answer for everything because sometimes there might be a hormone imbalance. It could be a lot
Hmm.
of things that we need to check out. But don't let the stigma of I don't believe in mental health stop you from getting the
Getting the help.
support. Yes, and getting the help that you need. Yes.
And
So,
so with some of us, we're still in that old in the day. All
yes,
right. So we have a tendency to hide that trauma,
yes,
hide the
yes,
trauma, hide the unsolved issues that we have.
yes.
What would be one of the steps that would be suggested for them to heal since they're not going to go to the therapist? And I
Mhm.
think that's the life coaching. I think
Yes,
that that's that in between person. I think
yes,
because we're not psychologists,
yes.
psychiatrists, and
Psychiatrist or psychologist.
psychiatrists. Yeah, the word I'm trying to say. So therefore, you don't get the feeling of going to a psychiatrist,
Yes,
but
yes.
yet you have these healing feelings. So
Mhm.
what would be the approach a person can heal from those unresolved issues?
Yes. You know, one thing that I love to do is when I'm connecting with people,
Hmm.
I ask them the question, is that thing still bothering you? Does it still come up in your psyche when you should be thinking about something else?
Hmm.
And is that working for you? Is that thing working for you to know that it's still bothering you? And would you mind talking to somebody about that situation? Right. And I think coaching being in the middle ground.
The middle lane.
Yes, the middle lane. Like, you're not
Yeah.
driving too fast in the psychiatry lane
Uh
and
huh.
you're not on the psychologist lane, but you're
Uh
right
huh.
there in the middle. And in
In the
the
middle.
middle, you can a lot of times people feel safer. It's like being a sandwich, right? So
Hmm.
the middle part, we're looking for great things to happen. And I think in the middle, coaching will allow people to feel safer until they can get to the next level.
Hmm.
So I'm a proponent of that as well. I
Hmm.
do practice, but I also do coaching. And I think that it's important that people understand the main goal is to help you live a thriving and a life that you're free, right? You don't have to have that cup of coffee to get you started. You can have some other tools like,
Hmm.
oh, it felt so good. You know how you speak with a girlfriend?
Hmm.
They're listening, but they're not listening with the third ear because they want to make sure that they're connecting with you and that they are being able to give you what you might need to hear. But sometimes you have girlfriends that will challenge you. They're
Uh-huh.
like, thinking right? Are
That's
you,
true.
you know, I have a couple girlfriends. You're included in that, right?
Yeah,
Paula, we're
I
looking
know.
for we're looking for our own challenges. And when I
Hmm.
get coaching myself, even when I
Hmm.
get coaching myself, it makes me look at me. And when I'm looking at
Hmm.
me, I can't look at anybody else, what they're doing, how they're doing it, why they're doing it that way.
Hmm.
Let me look at me so that I can continue to help other people.
Right, right. Yeah, I was saying that, and we went over the stigmas and things like that. What would be something that you would love to erase?
Ooh,
One thing.
one thing that I would love to erase is that therapy, counseling, coaching is for individuals who are, and I never use this word, but I'm just going to use
Mhm.
it. That is for individuals that are crazy. I don't use
Mhm.
that word because everybody has something going on. I would like
Mhm.
to eliminate that completely. That
Mhm.
therapy, counseling, coaching is only for people who are really not making it in the world. Everybody. I always use this, Mary, that doctors need doctors, dentists
Mhm.
need dentists. They can't get in there and do all that stuff,
No,
right?
that's true.
Counselors need counselors, coaches need
Mhm.
coaches. Everybody who is helping someone else, they need somebody else who can help them through that thing. It just makes sense that we realize that don't put us in a category that there's something wrong with us because we're seeking counseling or coaching or therapy.
Mhm.
I would like to eliminate that because everybody could use somebody to talk to, somebody
Mhm.
to listen. And
Mhm.
again, I believe in the power of prayer and I can talk to God. Yes.
Mhm.
But there's also the professional side. He made us to be professionals to help
Yes.
somebody else, right?
No,
So
right, right. Well, with all of our training.
yes, yes, yes. And we
Yeah,
learn as we
that's true.
go. And
And I
so
love it.
that's one thing that I'd like to eliminate, that it's only for the rich and famous.
That
That's the
too.
other thing.
Yeah, that
For
too.
everybody.
Right for everybody. Yeah.
Yes.
This is a wonderful conversation. My God, like it went so fast.
It did. Are we wrapping up?
Yes, it went
Oh
so
my goodness.
fast.
Yes.
Yeah, I
That
have a
it
little
went by
clock here,
fast.
and it lets me
Okay.
know.
And of course, we could do lots of other things too.
I
But
know we
that'll
need
be,
a part
I'll let you
two.
say that, but that'll be the next time.
Yeah, we need a part two.
Yes.
My goodness. So, Dr. Sutton, you're a life coach. So,
Yes.
can you share with our audience that how they can reach you in case they want to do some coaching with you?
Yes. I definitely share my phone number. It is on all the time, but
Okay.
it is 510-813-4446. Or you can email Aminta, Aminta, numeric number one, .am @gmail.com, or on the social media platforms. It's my name, Aminta. And then also you can find me on Instagram as Consultant
Oh
for
my goodness.
Change and Transformation, because I want to let people know. Sometimes people DM me and say, I heard that you do counseling or coaching. That's like, yes.
Uh-huh.
And we found your number because somebody else referred you.
Mm-hmm.
So, anyway, I can be reached, and always happy to return a call to see if I am the provider that you need to get the assistance that you need.
Very good. Very good. So, leave one last word with our audience.
I'm going to use, just because it's we need it right now,
Mm-hmm.
peace. Shalom, peace. because we all need peace in our life. We all need the peace that we definitely need, the one that surpasses all understanding, right? Because we can't
For
understand
sure.
all the things that are going on in this world. In America, things are wild. But
Oh,
I
wow.
just seek perfect peace when I'm going through something. I'm just going to seek
Mhm.
peace because that's how I'm going to move through to get to the next avenue that I need to.
My goodness. You have heard it today. You heard all the meat and the gravy today on this show. So until next time,
Yeah.
okay, you know where to reach Dr. Sutton. And so until next time, I'm going to say be safe,
Yes.
be healthy, and
Mhm.
be blessed. All
Yes.
right. This
Yes.
is Mary Henderson from Straight Talk About Health and Wellness.
Thank
I'm
you so
signing
much.
out.